I'll be right there. I'm a veteran in the business, but the Otis case? I'm only one man. All the time in the world doesn't prepare you for a situation of that magnitude. The kind of stuff that keeps you up at night. Solutions running through your mind. This is the last time.
Mr. Mullen, how are you doing today?
I could be better.
I'd like to ask you a couple questions if that's alright.
It's fine. Can I interest you in a drink?
I'm good.
Suit yourself.
So can you recall that specific case?
Where do I begin? When something like that comes across your desk, there's always that minute of panic where you think you should have done something easier. Something like working at McDonald's.
So what'd you do then?
The only thing I could do. I called them.
Them?
The team. Interdisciplinary team, assemble!
So does anybody know why we're here?
I heard the call.
You always answer the call.
Joe, how you doing? Last time I heard you were homeless by a dumpster.
I don't know about that. I heard you were living in a cornfield. I can explain.
You guys are smart people to track down. Alright, here's the game plan. This is where we were, this is where we are, this is where the job gets done. And this is our objective. Alright guys, here's the case, so listen up. Our patient's name is Otis. He's a 65-year-old male who had a heart attack in his home yesterday. When his wife found him, he was dazed and had a broken hip, which has since required surgery. The patient also sustained a fractured arm in the fall and is having trouble performing his ADLs. In addition, the patient also received double bypass surgery. The patient has severe COPD and as a result of smoking 2 packs a day for the past 50 years. The patient wishes to return home where he can continue home therapy and eventually be able to return to golfing every day with his buddies. You guys know what to do. You all have a special set of skills. Let's get the job done.
All right, team. From my side of the case, I have Mr. Otis on 320 milligrams of beta pace and 40 milligrams of simvastatin. Has anybody seen any side effects with their treatment with this?
As a nurse, I've been seeing that his heart rate's been a little lower than we like to see, so you may want to consider cutting that beta pace back a little bit.
Okay. I'll make sure that I cut that dosage back to about 240 milligrams.
Another thing I noticed was that he had a sore on his sacrum, so OT and PT may want to keep an eye on that throughout treatment, and even when we take him back to home health, you guys just keep an eye on that pressure sore.
Sure.
Incisions look good, so the antibiotics are working good, physician.
Okay. Joe, how's physical therapy going?
Yeah, just a couple notes on Otis that I've jotted down here. He has demonstrated independence with all his bed transfers, and he's continuing to ambulate with a wheeled walker. As for his living situation at home, he did proudly state that his wife will be there to help in all situations, so that's good. There's one stair for him to negotiate when entering the home, and we effectively practiced this challenge, so he's good there. And then one final goal that we completed was safely getting in and out of a vehicle, and he demonstrated independence with that. So, yeah, I think he is ready to improve his state of health at home. And, I've been working a lot with Danielle in the occupational therapy program, so what do you think?
Well, the fracture he sustained in his arm was pretty small, as you know. We're giving it time to heal on its own. The fall did affect his left hand a lot. It's pretty stiff. We've been working with a lot of paraffin, and that's been helpful. He mentioned his wife has a paraffin machine at home for cosmetic purposes, so I told him to keep using that. Just some general strengthening and mobility, particularly grip strength, but he's looking pretty good at that. His activities of daily living, still struggling a little bit with the fine motor tasks, buttoning a shirt and tying his shoelaces, but I've talked to his wife about helping out with that. I would say I'm pretty comfortable with him going to transition to home health, as long as I can have a good dialogue with the occupational therapist who will be taking care of him.
Okay, that's very good. That's in agreement with the way I was looking at this and the fact that despite all of his comorbidities, that he's pretty stable, and I don't think he's no longer in need to be in acute care. Everybody would agree with that?
Yeah.
Okay. Is there any recommendations that we have from you, AA and Ron?
Well, nutrition is going to be very important for Otis. With his heart disease, healthy eating habits can help slow or even partially reverse the narrowing of the heart's arteries and help prevent further complications. So we want to focus our diet on cutting down on cholesterol, lowering his blood pressure, lowering blood sugar, and help maintaining a healthy weight. Some key points of the diet are going to be serving more vegetables, fruits, and whole grains. We want to limit saturated fat and artificial trans fats. We want to choose lean meats and fish, limit red meats, choose carbs such as brown rice, oatmeal, and sweet potatoes for fiber and to control the blood sugar. And we want to drink plenty of water and cut down on our sodium intake. So I've come up with an individualized diet program for him to take home, and I think that'll really help improve his health status at his home.
Okay. Very good. Be sure to discharge him in.
I gotta give it to you guys. He did it again. Never had my doubts. The rest is history. We knew Otis was in good hands.
Just like that?
Just like that.
No one told you life was gonna be this way. Your job's a joke, you broke. Your love life's the away. It's like you're always stuck in second gear. When it hasn't been your day, your week, your month, or even your year. But I'll be there for you. When the rain starts to fall, I'll be there for you. Like I've been there before. I'll be there for you.
It's been a few months now, Otis.
Yeah, 3 months.
Can you tell me what exactly that team did for you?
They gave me back my health, my independence, just everything.
Quite the group, huh?
Look, there's the Expendables, there's the Avengers, and then there's my interdisciplinary team.